It's been 3 hours since we started these speeches. One COVID death is happening every 5 minutes in the United States. We've seen 36 people die since the beginning of these speeches because COVID kills, because long COVID kills. And we have a president who has neglected this crisis. We have a CDC who has neglected this crisis. The CDC should be criminally investigated for what they have done to people, for what kind of minimization they've created for COVID. President Joe Biden should also be criminally investigated for not even having the respect to hold, for instance, a long COVID press conference. We're not even caring enough to get us long COVID legislation. Where is our legislation? Where are our antivirals? Where are the antivirals? Over 5,000 people confirmed dead with long COVID, and yet no antivirals. We have an NIH trying to spit out the most nonsense clinical trials you could ever imagine. They know. We've spoken to them. LCAP sat in their room with their scientists. They know viral persistence is real. They know there are blood panels we could be doing right now. There are transcriptomic blood panels that will show you a viral load test with your long COVID. It will show you how much SARS-2 is in your body. SARS-2 persistence is killing people. It's crippling our society. We have demands for the United States. We have demands for President Joe Biden. Those demands were drafted by people within the long COVID community, many of whom could not be here today because they are too ill, they are too debilitated by this disease to be here. But they have come together to find consensus on how to move us forward. And that consensus meant that we need to declare long COVID a national emergency in this country. We spoke with David Cutler, the Harvard health economist. He stated that long COVID is going to cost this U.S. economy $3.7 trillion over the next 5 years. $3.7 trillion. And he said that in order for us to deal with this problem, we should be looking at it at a minimum amount of $28 billion annually. $28 billion annually in legislation to get what we need, to get the treatments we need, to get the social support we need, to get the programs that we need moving forward. LCAP has been lobbying with Congress. We've been lobbying with the Health Committee. We asked to be represented, to make sure our scientists were represented at the HELP hearing. Over 400,000 letters were sent to members of Congress. Over 400,000 letters were sent to the FDA, CDC, NIH, demanding that we had this representation at that HELP hearing so that we heard about viral persistence. We heard about SARS-2 persistence. We heard about novel antivirals. And that became the focal point of that hearing, but it was not the focal point. They wanted to continue to minimize this disease. And we say to them the same thing we said to the people yesterday that we lobbied with. Where are our antivirals? Where are our treatments? Do we need to watch more people die? We are looking at the HIV/AIDS crisis with long COVID. We have the science. ACT UP taught us how to do the activism. We need to rise up together. We need to get direct. We need to create direct action, bring it in front of Congress, take it to the president, take it to everybody here in Washington, D.C., take it to Big Pharma, take it to the banks. We need to show up everywhere we can show up, be as loud as possible. We have to take power and fight back. And LCAP fights back. You know, I would not be here today if it was not for the love and care of my wife, who also is suffering with long COVID. My family. And to everyone out there, we were going to continue to fight for you. We were going to continue to demand antivirals. We were going to continue to demand an emergency is met. And we're going to continue to demand that the funding is met. We're going to continue to demand that there is equality, that the discrimination is ended for both BIPOC plus, LGBTQ plus communities. We can no longer allow our medical system to create this inequality that we're facing, where people get dismissed the way that they have in the stories that we've heard. We have to fight for equality as much as possible. We have to. And we need Bernie Sanders to show up for us. Where are you, Bernie Sanders? Where the hell are you? How many more signs we got to make with your face on it till you're out here standing with us? You need to be right here. We're going to have more people in this coffin. More people dying needlessly all across this country. Over 1.1 million now now killed in the United States. Over 27 million people across the United States with long COVID. With the numbers increasing more and more every year, with infections increasing more and more every year because of the CDC guidelines. So now we've got 1 in 4 people developing long COVID. 25% chance next time you get infected, you'll develop long COVID. You carry that number globally, that's over 275 million people. This is an international crisis. It needs international attention. The United States should be drafting a PEPFAR-type legislation for long COVID, and we should be drafting a Ryan White CARE Act-type legislation for long COVID. We need the funding, and we need antivirals now. Declare long COVID a national emergency. Antivirals now. Declare long COVID a national emergency. $28 billion now. Declare long COVID a national emergency. Long COVID kills. Long COVID kills. Long COVID kills. Antivirals now. LCAP fights back. Love and solidarity to all of you.